nations such as US, Europe, India, Afghanistan, China, Singapore, Japan, and Middle East are pioneering these technologies, shaping a future where cutting-edge innovation and human compassion converge to create smarter, safer, and more patient-centered healthcare system. The primary goal of this webinar is to offer meaningful insight for everyone involved in medical and clinical research. We are delighted to have participants from a variety of fields including life science, pharmacy, medicine, nursing and related professions joining us from across the globe, from Afghanistan and India to USA and Europe. This diverse gathering truly reflects the global spirit of collaboration and learning in healthcare and research. Before diving into the session, let me share a brief introduction to SCRMP. SCRMP established in 2024 and the headquarters is in Telangana, India. SCRMP is an international dedicated society already registered in India and USA, working to advance clinical research and support healthcare professionals. Through initiatives like workshops, webinars, and our publication Health Kingdom, SCRMP empowered to professionals by fostering innovation, collaboration, and education in the field of clinical research. Let me also highlight that the Society of Clinical Research and Medical Professionals is a registered society under the Society Act 2001 in Telangana, India. Registration number 417 by 2024, Niti Aayog NGO Darpan ID TS 2024 046 272187. In addition to being registered in India, SCRMP is incorporated in USA as a New Mexico non-profit corporation, establishing its recognition as international organization. The society is committed to advancing the field of clinical research and supporting healthcare professionals, aiming to be a gateway to excellence in pharmacy, medical and clinical research.
On their medicines, they can write down their emergency contacts, etc. This is very useful. So one takeaway for all of you today is please check if you have a list like this. If you don't, please kind of get the app or include medications. Please do this as a service for your family, for your grandparents, for your parents, your aunts, uncles, others in the family, where you can make a list of their medicines, their blood group, their immediate doctors to contact. So this can be an immediate takeaway from today's talk. I think it's also important that these devices are always there with you. Many of us sleep with them and you're on your hand, and then sometimes you get an alarm, but you can also, they measure your sleep, they measure the signals that come from the heart. You can also check your oxygen saturation, it picks up atrial fibrillation. You can also detect whether you're falling, sleeping and how fast you're moving. This is a number I like to think about. It's called 4. And it's called 4 because there's about 8 billion people, only 4 billion have healthcare. Half the world has no healthcare. And it's kind of sad that that's the reality, but according to WHO, half the world has no healthcare. It's important that we recognize that even the things we're talking about, maybe 1 billion people have it on the planet. So as long as we're not really reaching out for everybody, then we haven't achieved our goals. Now, WHO also says that you should do very simple things like walking 150 minutes a week to decrease your risk of heart disease by 30%. In India, for example, the average daily steps is 5,000 versus 7,000, the global average. There are many smartwatch companies, Apple, Garmin, Samsung, etc. And you can kind of put alerts in that to nudge you towards 10,000 steps. Now, of course, sleep is very important. I say I'm preaching about sleep, but I don't sleep well myself in the sense that you're generally working, doing other things as a doctor, you're on call, etc. But when you have sleep stages, you have a light sleep, deep sleep, you have the rapid eye movement sleep, and these can be tracked with devices. And if you have a less than 6 hours sleep, there's a very high risk of increasing heart attacks. And in adults in India, over half of them, urban adults, report poor sleep quality. So it's critical that we think about how we can actually make sure that we are sleeping better. Some of this involves getting rid of technology. You need to start dimming the lights, don't have any exposure to light for about, I would say 3 hours before you sleep, in fact. Very hard to accomplish, but something to think about. Now, there's a concept called HRV. It's called the heart rate variability, and the variables measure it now. I bring this up because this is a good marker of stress, recovery, resilience. In fact, if your HRV is high, it means that you have better autonomic balance and lower mortality risk. We still don't know why this happens. So a lot of the technology we have now are introducing concepts which we didn't know about. You're getting signals from patients, you're getting heart rate signals, blood pressure signal, but we never measured it so often. So typically you would go in to see the doctor once a year, maybe twice a year, maybe once in 2 years if you're very healthy. Or if you're a little sick, maybe you're seeing them once in 3-4 months or so. So you get maybe 4 readings of blood pressure. Now you're getting a reading like 60 times a minute. You can get it many times a second if you have some of these automated readings. So nobody really knows how to interpret this. But one concept is the HRV, and this is highly tied to some of these outcomes. And we still have to learn, and this is where the research comes in, where you have to understand how do we actually understand why this is linked. And we'll be coming up with more and more such things as we use technology in our daily lives. And most of these are patient safety devices, both in the healthy patient as well as somebody who is sicker. You can use these. The next, of course, is the era of invisibles. I talked about the radar device, which looks at a patient through radar and can actually create like a heat map or a weather map of the patient, and you'll know if they're standing or lying down. You can even measure vital signs with them. Now, of course, you have multiple technologies now. You have a cough detector that can pick up whether you have a lung problem, and using AI just for the sound of the cough. In fact, I've heard of studies where just from a cough and the voice, you can detect what is the pulmonary artery pressure. So these things are evolving very rapidly, and it's important we keep track and keep in touch and make sure that we pick only what is useful, because otherwise you'll be flooded with technology that is not useful. There are other kinds of things we can look at, including measuring blood oxygen level. And of course, I mentioned to you about the heart rate. In fact, I also heard that you can measure HbA1c just from a camera view. The other bit I want to talk to you about is that there are plenty of places in the world where diabetes is very common. You also have hypertension that's very. You also have plenty of places where, if you look at that map, India, China, America, it's quite common, a very high incidence of these problems. And, I would call it the sweet spot where, most of us have a lot of diabetes in India. But it's important to recognize that all of these variables provide an early lifestyle alert. And these can be helpful, and especially in a country like India, and maybe other parts of the world where you're attending from, it might be useful to use these to follow and track diseases and detect them. Now, there are, many of you may be working very irregular hours. You may have issues like, you're a worker and you have irregular sleep and stress. You can look at that, but you can adjust your habits and very quickly you will see changes. So these devices can also be a wellness coach almost, and it can actually tell you what needs to be done, and it can actually guide you in terms of your movement. Now, we talked about the photoplethysmography, where from the camera view, you can look at the heart rate and the oxygen. You can also look at the accelerometer to look at movement and falls. In fact, they're looking at things like Parkinson's disease getting picked up very early, before it even shows up with the tremor and the stiffness, because the gait gets abnormal. So there people are looking into those also. And of course, using cloud technology and artificial intelligence, you can get predictive alerts. Now, we've talked quite a bit of many of these, but there are, of course, stresses which you can't handle always. For example, the device may be out of battery, the data might be an overload, you've not upgraded the software, or you upgrade the software and then you ended up in not having a good usable device. Accuracy might vary from movement. There can be